Hello and welcome, everyone. Thank you for joining us today on this busy Tuesday morning. I'm sure we appreciate you taking the time to be here. We are here to join Kristen Dempsey, who's going to take us through motivational interviewing, the foundational skills for behavioral health providers. First, I'm going to go through a couple of the details for today. The first slide we're going to go through is just a little review of the Zoom controls. If you could go to the next slide, Kristen. Just a little refresher. I'm sure we're all professionals here and we've done this a million times a day. If you are not actively participating in the conversation, please go ahead and mute yourself at this time. But we do want to see you. Makes us all feel that we're in the same room together to be able to see your face. It's kind of nice to see everyone. As Kristen mentioned, if you are just joining us, be sure to put where you're from, the county you're in, and what your position is, and maybe an emoji for today. You can participate via nonverbal participant feedback, show an emoji, whatever you'd like. And I'm Jerry Walcott. I'm going to be your technical assistant for today. If you have any questions or need anything, please don't hesitate to reach out via the chat box. I'm happy to help however I can. If you'll go to the next slide, Kristen, I'm going to go over the continuing education. We are offering continuing education for today's webinar. You will receive credit by being logged in for the entire duration of the webinar, which we will be monitoring your attendance. And if you have the ability to do so, please rename yourself to your first and last name, what you registered under. If you're working as a group, you have to log in on separate computers to receive continuing education. You need to participate in all discussions, keeping your video and audio engaged but muted at all times. At the completion of today's training, you will have a link to an evaluation survey that you'll need to fill out. We are offering for LCSW, MFT, LPCC, LEP, RN, and then the addiction treatment specialty licenses, which aren't listed here, CCAP and CADTP. And if you are watching this recording, unfortunately, you're not eligible for continuing education since it's a live training. And with that, I'd like to take a moment to introduce Kristen Dempsey. Dr. Dempsey is a licensed marriage and family therapist and a professional clinical counselor. She has provided psychotherapy in the Bay Area for almost 25 years in public, nonprofits, and county mental health settings, schools, and medical clinics. Her current psychotherapy practice is located in San Francisco and Burlingame. Thanks so much for joining us today, Kristen.
Hey, thank you so much, Jerry. It's a great introduction. Appreciate everybody being here. And welcome to Motivational Interviewing. I am sure probably a number of you have had motivational interviewing somewhere in your career, but I certainly can't make that assumption. So today might be a bit of a refresher, or it might be motivational interviewing for the very first time. I kind of design it to a lot of different needs. So one thing I'll say as we get started is we have a lot of slides and not always a lot of time, which happens. And I often will do a training over 3, 6, 9, or 12 hours, but we have an hour and a half. That said, I still think we can do a really helpful training and get to all the main points. One of the things I like to do with this type of training is to allow you to participate, even if it's a very short period of time. Just because if you're participating any of us, we retain so much more if we participate, even if it's the smallest thing. For today, that participation will be probably in the chat box. So I'm going to go through, give you various ideas and concepts, think about different aspects of application, and I am going to stop and ask you, hey, put something in the chat box. And there's a lot of us right now. So even if not everyone puts something in the chat box, I anticipate we'll have a lot of great feedback and information there that I can draw on and make the training a bit more interactive. So I am calling this Motivational Interviewing Foundations for Behavioral Health Providers, although in many of my trainings, I have people who do all kinds of work. And in fact, motivational interviewing is being used for people who are in helping professions of all sorts, whether that's in healthcare, it's human services, in corrections, in school-based practices, really all throughout the healthcare and human services world, where we're really trying to help support people in their change process. I'm looking forward to today, and I know everyone has slightly different needs, but by all means, feel free at times to raise your hand. I'll stop and check and see how you're doing, if you have questions, and we'll continue to just explore all the different aspects of what motivational interviewing is. This is a little bit about me, as Jerry indicated, a professor and a therapist, Bay Area, and I enjoy training all over California. You may have seen this book before. This is is kind of the main text of motivational interviewing. It's the third edition, and everything that you see in these slides are from this book. So I jokingly say trigger warning in that I will not go through all the slides just because of time, but I did not want to deny you slides. Sometimes if I talk about something and have a slide and the people I'm training don't have the slide, that makes them very unhappy. So I have tried to give you more than you'll need. And if we don't go over them, just know you'll be able to use them as backup and to go into more detail. So hopefully a lot of these slides will kind of build on themselves. And some slides where we might typically have done a breakout room, I might just pause and do something in our chat box. So thank you again for your flexibility. By the way, in addition to this being a great book and being very readable, I'm curious, you can feel free to raise your hands or to indicate somewhere in the chat about how many of you have actually read this book or looked at this book or know this book. It's very helpful. It's a wonderful guide. And if you're thinking of buying it, certainly I encourage you to do that because it is so incredibly useful. But the next edition, the fourth edition, is going to come out in 2023. So, and some of my updates in this slide deck today include some of the most recent updates to the motivational interviewing. I always like to start with a definition, and this is a particularly detailed definition. It's what we call the kind of more technical definition about motivational interviewing being a collaborative and goal-oriented style of communication with a particular attention to the language of change. Is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring a person's own reason for change within an atmosphere of acceptance and compassion. And when I do my longer trainings, I often take quite a bit of time just breaking this down and really thinking about all these different pieces, because almost every word in this technical description really speaks to something very important about MI. And I'm wondering, as you're looking at it right now, what words really stand out for you? What kinds of things are you really thinking about? So feel free to start to add them into the chat box. And I'll just point out a few things that you'll want to pay special attention to as we go through the training. One thing, okay, so a lot of people are noticing collaborative. Absolutely, collaborative is really important. And that's one of the places where sometimes we make a mistake is if we get too far ahead of someone and start indicating goals that they're not ready for. Talk about that more in a minute. You'll notice goals, and some of you are noticing goals, are in the definition twice. And why are goals important for motivation? They're important because we cannot get anywhere without a goal. We can be really unfocused and kind of go into circles or just not really move anywhere because we're not sure where we're going. Think of goals like a compass. It's often the way I think about that. Many of you are noticing things around acceptance and compassion. It's an important aspect of the spirit or the attitude that we bring to the work of allowing people to start where they're ready. Some of you are also noticing, of course, this idea of communication, and it's a style of communication. You'll notice we do not call it a counseling technique. That's because we were bringing all kinds of people into the motivational interviewing world, and we're testing, and there's been over 1,700 controlled trials of motivational interviewing. It's incredibly tested right now. We don't have a meta-analysis of those 1,700 studies. Nobody's really stepped up to say they'd be willing to do that, at least not quite yet. The outcomes are overwhelmingly positive, and these studies are all throughout, kind of like, as I said, healthcare. So there's a lot of flexibility to this particular approach. Yeah, and some of you are also noticing language of change. I'll be talking about what we call change talk. We're listening to people and we're being very curious about just the words they're using that helps them move towards change targets. Right? We can talk about all kinds of things, but what kinds of things are we saying when we're in the process of changing? There's a few other pieces of this that I'll get into later, but if you want to really simplify this definition, someone asks you, what is motivational interviewing? Sometimes I even have clients I work with ask, like, what is that? Is it like a motivational speaker? Like, what do you do? I tell people it's a way of having conversations about change. I think that, in a way, as simple as that is, really speaks to what it is we're trying to do here. So one thing I also like to think about too is to give you all an idea of MI as being not directive, as in right side of this little screen here about giving information or giving advice or telling people what to do, but it's directional. That is, it's guiding. So in some approaches, maybe even like classic Rogerian approaches, we tend to listen and follow what someone says, and we might follow and reflect. Or if we're working more psychodynamically, we might be working with various aspects of the relationship, etc. And the person we're working with is really leading all of the work. With motivational interviewing and actually solution-focused approaches, it's really about starting where the person we're helping is and then gradually guiding somewhere. And in this case, it's around a change target. So how do we start where someone's willing to start, and what kinds of things are we doing kind of move them toward change? This brings us into a really important concept around the spirit of MI, which is really a fancy way, maybe it's a fancy way, of saying the values and attitudes that we have that allow us to do this work well. And why I say values and attitudes, it's about our positionality. We can think of it as maybe our stance, our therapeutic stance, how we approach someone. What kinds of things are we trying to be aware of just in our connection that really allow the motivational interviewing style to flourish? And this is really critical because when I've consulted with people, clinicians, and there's been challenges, like I'm trying to do this motivational interviewing and I'm stuck. I'm not sure what to do. I keep kind of going around in circles, or someone isn't really involved in change. What's going on there? Many times it's not technical stuff. It's not about not doing a good reflection or not asking open-ended questions, which I'll talk about later. Often there's something going on in the practitioner's spirit. There's an attitude or approach that in some ways is functioning to alienate the person they're working with. Maybe not consciously for anyone, maybe not clearly, but it's creating that bit of tension. In motivational interviewing, we have a great way of thinking about being in sync with someone. And we talk about this. Are we dancing with someone? Does it feel like the work is like we're dancing and we're kind of together and we're working together in collaboration? Or does it feel like we're wrestling with someone? And probably everyone on this call can relate to that, right? Times that you can remember where this is a great session. That's what a great session often is. Like we're just moving along and it's smooth and I enjoy my work. I love my job. This is fantastic. And then there's other times where it just feels like pulling teeth. And in motivational interviewing, one of the things we do is when we feel like we're wrestling, that's like an internal little assessment. If it feels like I'm pulling somebody's teeth, it should never feel like that in MI. It should never feel like that. And I go back usually to this and think about, is there something in this spirit that's off for me? This is the place to start. So in a couple of minutes, I'll make clear what I mean by that. And let me just define for you each of these little circles, because each one together on this little Venn diagram, when they all are present, that's where we have the spirit of MI. So one, you all already noticed before in the definition, is collaboration. And collaboration is truly being in partnership. So it's not about me picking all the treatment goals, for instance, even the person I'm working with, having them pick all the goals that may not move them toward change. But it's really about us talking together about what seems like a reasonable place to start. Where's a place that we might start in some direction towards, there's some aspect of health or goals or something that feels meaningful for the person we're working with. And let me give you an example. You probably work with people who are mandated to treatment, or what I like to say, voluntold, and they're coming in and it may be they're mandated because somebody may be in probation or maybe a school principal, that they have to be here, or they feel compelled, even if it's not a legal mandate, to be there in order to deal with a behavior problem. Maybe it's drinking and driving, or maybe it's getting into fights on campus. Me, as a person receiving services, I might not be so happy with any of this, but I came for a reason. Why are you here? Well, I don't want to be in jail. Well, I don't want to be in detention. So those are places we can start to collaborate. Maybe the wording of I need to, or I'm ready to quit drinking, that might not be where someone's ready to start, but I'm ready to start staying out of jail. So how can we collaborate together to help you stay out of jail? And generally in that conversation, eventually what's going to come up is often somebody's substance use, right? So we start where someone's willing, and usually everyone who's sitting in front of us is willing to do something because they came. And we know people, I've known people who absolutely did not want help, and they found ways of not getting it. I mean, they just did some extra time in jail, or they just, did the extra detention time, or whatever it was. Most people, when they show up, there's some very tiny motivation. How about compassion? Compassion is a special type of empathy where we're really connected to someone's suffering, and our goal is to help reduce someone's suffering. And what's important with motivational interviewing then is when we come to MI with a compassionate attitude, it's about how can I be in service of the person who's in front of me as opposed to anyone else. With my example of the folks who've been voluntold, I know there's a probation team, or there's a principal, other people out there. And even though I have to work with those folks and be professional, ultimately at the end of the day, the person who is really my customer, so to speak, and who I'm really in service of is the person sitting in front of me. And there may be times when there's rules that are part of a program or what have you that maybe I have to attend to, I have to be aware of, I have to be honest about. But ultimately, it's about what we put on the treatment plan, or what we're really working toward is something that's someone's bought into, we're collaborating on it, and it's really for their best interest. And just a little backstory on this, the idea about being compassionate and working in the interest of the people we serve is so these very powerful skills don't become easily used as just, marketing tools or motivational interviewing skills to talk people into buying things, right? We're really trying to keep this as like a human services type of approach, right? Not a sales job. And then we have evocation, and I kind of call this evocation slash empowerment. And in the fourth edition of the book, this is going to morph more into a conversation about empowerment, which is how do I help someone really explore, and that's what evocation's about, help them talk more than I talk. Have me step back and listen for their reasons and needs and ideas around change so I can help them be empowered to take the steps toward change that need to be taken. Because ultimately, we're going to have to help them, get in touch with their particular skills and abilities and potentials for change. Acceptance is really a component of being non-judgmental. So how can I work with someone in a way that really allows them to feel like, it's okay that they're showing up as who they are, and wherever they're at is absolutely reasonable. So in my examples, maybe the person who comes in for their DUI, maybe this is their seventh DUI, and I don't need to be concerned about their reasons why that's the seventh DUI as much as I'm just welcoming them. And here they are, they're in the right place now. Like right now, they're in the right place. This is really important. How can I just be open to all that people bring? Again, having acceptance, suspending judgment, being able to affirm components of their being here, and just having an open willingness, flexibility to work with them as they show up. Yes, these are the greatest pieces of motivational interviewing. I agree with some of the conversations in the chat box. And one of the things to remember too, I think, is sometimes people get a little bit concerned about saying things the right way in motivational interviewing. Was that reflection really said properly, or is that the best open-ended question? And here's the thing. With this approach, if we're more conversational, if we're more, even kind of relaxed around that, the actual constructions of a lot of our interventions isn't as important as those interventions coming from this place of spirit. So as long as what we're saying is really trying to be able to empower and to collaborate and be compassionate, which isn't always really easy, but it takes some practice sometimes to really start shifting from trying to control outcomes to being curious and engaged with someone. That's what really seems to really matter in terms of helping to create the change we'd like to see, or our clients, the folks we help want to see. So so thank you, Kathleen, for that. You're absolutely right. We can all kind of relate to other people's imperfections, because we all have them, right? And to be able to hold that with respect and care is so engaging, and that is motivating. If I feel someone's really wanting to collaborate with me and they care about me and it's my choice and they're listening to me and wanting to hear me talk and accept me for where I am, I'm more likely to participate. So one of the things I'll do here for a little exercise in the chat box is think about a time for yourself when you have engaged in change. Maybe it was a time in your life where you were making a transition, or you're growing, changing, learning. Think about some of the people who helped you change, some of the people who are really important to you. Could be teachers, mentors, family members, supervisors, and what kinds of things did they do for you that really are consistent with this idea, the spirit of MI? In what ways were they collaborative? In what ways did they not judge you? In what ways they show kind of compassionate care towards you? Really allowed you to speak your own truth and be empowered to make your own mistakes, as well as make your own choices. Think about that for just a couple minutes as I advance the slides. Yeah, so I'm noticing there's a lot of encouragement and support. A lot of these listening and supports and encouragement, it is really, there's a combination there of accepting somebody for where they're at. The support is like allowing people to just be able to be evocative and speak their truth, kind of learn from their mistakes, as well as their own things that they're caring about. There's a lot of feedback in here. So feedback, I think a lot of times is very important around collaboration. Yeah, encourage me to move toward my goal, right? So that's also, I think, an important aspect of being accepting. Like you can have your own goal and I can accept you and allow you to move toward that instead of having to create it for you. Yeah, non-judgmental, Donna. So we're getting to that acceptance, actively listening and encouraging, Active listening is so much a part of the empowerment and evocation place because that listening part means that someone else is allowed to talk. Yeah, there's enough here. A number of people are noticing compassion and validation, which really, again, are speaking about that, wanting to be connected with one's suffering and to help reduce that and to acknowledge someone, right, with that real acceptance. Nice, and feel free to keep dropping those in there. One of the things I also like to let people know, and this is really important, you're all doing different jobs, and many of you have different theoretical orientations. Some of you work differently, and some of you are like, I'm not even a therapist. I'm doing, mostly some aspect of, say, care management or maybe this psychoeducation or various pieces. So here's the beauty, the absolute beauty of motivational interviewing is think of motivational interviewing as not as a theoretical approach, as I mentioned earlier. Think of motivational interviewing as an engagement strategy that we combine with your best practice. How do we do that? What does that mean? So you may have seen the stages of change. Most people are kind of steeped in this in much of our training. And there's like kind of these 6 categories. They can be fluid. People can move back and forth. People are in different stages of change for different problems. So this was developed probably over 30 years ago by Prochaska, De Clemente, and Norcross. So you may be familiar with some of the literature, but often a place where if we're not thinking we have a problem or not, I'm not interested in change, we call that place the pre-contemplation place. Back when I was trained in substance abuse training, we'd call that like someone being in denial, right? Someone being resistant, someone being difficult. And the way we shift it now, it's like, no, it's like they're just not thinking of change. The contemplation place is more like true ambivalence, right? I'm aware that there's a problem. And it's a great question, Edgar. I'm going to answer your question in a second. I'm aware of the problem, but I'm not doing anything. I'm not really sure. Do I do this? Do I do that? Preparation is cognitively, I know I want to make a change and I'm thinking about it, thinking how to do it, but I'm not actually doing it yet. In these 3 areas, and I think this might answer some of your question here, is this right here is where we're starting to use MI. So MI is what we use when we have people who, I don't know, I'm not sure if I want to, other people are making me, well, yeah, I'd like to, but I haven't yet. Those are the places where we're going to be like, help me understand. Let's have a conversation. Let's help folks get focused and tell me more about it. What do you think you'd like to do next? It's like we just do this kind of massaging of someone's motivation and interest and really help them feel safe, psychologically safe, to then start to go to this place at the bottom, which is where we often want people to be, so to speak, which is active modification of behavior. Now I am changing my drinking patterns and I'm not drinking and driving. I am not getting into fights on campus. I am exercising more, or whatever it was that someone decided they want to do. And then maintenance in this stage, again, is more of sustaining the new behavior. But people do relapse. All of us relapse. Behavior takes practice. And we make steps forward and then we kind of fall back and we take more steps forward. And every time we re-engage somebody in this process, we can alter and shift and help practice and find new skills. And this is a very helpful model. I think it's very helpful to really be thinking about like, where might somebody be here? And it can be a bit fluid at times, but we start where someone's willing to start. So that's why in the motivational interviewing world, and again, this might be answering your question a little more specifically, like when do I actually kind of know to use MI? Basically, you ask yourself, what is the goal here? What's the target that we're looking at? And the thing that the person's really kind of coming in for, that's organizing most of their work, that we're kind of speaking to, even if they have specific things that they're motivated around. And then are we in action around that thing, or are we in pre-action? And if you find yourself in pre-action, that's where you use MI. And it's a pretty, I think, helpful kind of rule to think about that. Let me show you a few other things here. Another thing about motivational interviewing that we've noticed over time, when we first started it, it was definitely being used for, and still is, for a lot of behavior change. Right? It was in the substance use field, right? Whether someone changes their substance use patterns or not, but we also use it a lot actually in medicine around things like, say, like diabetes management or smoking cessation, exercise, weight management types of things. Also maybe taking medications, medication adherence, like managing like high blood pressure, et cetera. But it can also be used more for like cognitive processes as well. So in this example, someone can have as a change target, like I want to make a decision, and decisions are often big places of ambivalence. gratitude. I want to be a different person. I want to be, more compassionate or assertive. I want to have some acceptance and think about things that we're often working with in life, even some existential crises, especially right now around grief and loss and tolerating anxiety or an uncertainty. Boy, is that something that we're all dealing with in certain ways as now. So thinking that it's just about behavior limits MI. It can also be about these other cognitive processes as well. As long as you have something that could be a change target, you can use motivational interviewing, usually in the early action stage. And I'll just say here too, before I go and show you our little process planks. And by the way, the slide before, I'll just hold this for you so you can look at it for a second. These are the notes for the next slide. As we think about MI and being in pre-action, just holding this idea of ambivalence. And back in the early models of MI, it was more of a thought around ambivalence is this thing that we're trying to resolve. It's this state of mind, this feeling two ways around something. Let's try to find ways to get over that. And we've really come to more of an explicit understanding of a list of ambivalence is actually our friend at times. Ambivalence actually means we're already in a change process. So it's a bit about looking at the glass being half full instead of half empty. If I'm a clinician, I'm sitting with someone who is maybe really struggling to be adherent to their medication regimen, rather, and I could be thinking of, oh, this person, like they're not adherent, and they're not sure, and they're going back and forth, and I'm so frustrated with the part of them that's not changing. I don't get a chance to look at the part that is changing. Maybe there was a time when they might have needed medications and it could have been a benefit and they completely refused. Maybe there's a time when they would even come in to talk to me, right? So it's like there's this ambivalence, and I want to identify those places where they're actually moving towards something. So ambivalence is normal. It's part of the human process. We've all been ambivalent about things. And in fact, in a few minutes, I'll even ask you to think about that. Times when you've been really struggling, feeling two ways about something. So if we're thinking about MI as a process, this sometimes can be helpful too, because I've had training, I know early in my training career too, and I learned motivational interviewing. I learned about this great spirit, which is our values and attitudes. And I learn about the skills that would help us do motivational interviewing. But it wasn't really always totally clear to me, where are we going with this? And so I think having the stage of change model can be really helpful in that regard. So think about this engaging part down here. See my little cursor's pointing at it. That's often where someone's pre-contemplative and they're not really sure, maybe slightly contemplative. As we go to the next stage, which is focusing, what we're trying to do in engaging is just let people talk about anything that's coming up for them. And then we try to notice dominant themes. And what are some things that we maybe can collaborate together that would be an area of focus? To continue with my example about someone who might be referred for using alcohol, maybe I listen to a number of things in the engaging stage that they're really unhappy with. Having fines from the court, not being able to make their rent, being stressed out about how they're going to get to work, being angry about being pulled over. There could be a number of different things. I only got to summarize all the different types of issues, and then I'm going to move into this little blue area and say, I'm hearing you say you're really frustrated about losing your license. It feels unfair to you. You need to have your license go to work, because if you don't go to work, you're really concerned about being evicted, and you want to be able to take care of your family. So given all these different pieces in our work together, what would you like to be focusing on? And it can be more than one thing, but what we do is we make a list. It could be part of the treatment plan. Sometimes we draw it out, just circles on a map of here are the different things we're going to focus on. And it doesn't matter so much what it looks like, as long as it happens. As long as each time I see someone, we're going to get refocused. Because one of the biggest problems around motivation and change is when we lose focus, and then folks keep coming back. And I know I'm like this when I talk to someone. It's like I'm often focused on the problem of the week, right? There's always something coming up. There's always something that's really distracting. There's always something that's like, oh, let's talk about this week because it came up. And then next thing you know, you're working with someone for 6 months or 2 years, what have you. And it's like, well, kind of progress has there been? Besides maybe feeling connected and listened to, which is nice, has there been much change process? So even with the focusing, if I have people come back week after week with different issues that come up, I try to then link it to what's already on our focused list. And almost always there's something that I can link back to. Because usually if someone can identify some big concerns for them, they're big and they often run into all various aspects of their life. But we can add things to the list that someone wants to focus on. We can take things off if someone feels like they've managed it. And so, with the focusing list, what we then do is say, which of these things would you like to focus on right now in our time together? It's important, I think, to have one area of focus at a time, although as we talk about them, it might expand. So maybe in this case, uh, maybe my person wants to talk about getting their license back. So, okay, let's focus on that. And we go into being evocative. So, help me understand what's your sense of what needs to happen for you to get your license back. So what we do in the evoking stage is we try to really generate all kinds of discussion, very much try to be the person we're talking to does most of the talking. If they do 80% and we do 20%, that's great. And we want them to be talking and talking. And we open up with an open-ended question, do lots of reflections. Maybe there's something they're doing we can affirm. But what we're listening for, here's our place in this pink zone, although it can happen anywhere. But here's where we're more likely to start hearing reasons for change, right? All the frustrations, all the things like I want or I need or I have to do. And what we're doing is kind of remembering all the different pieces of change. Because what can happen then is as someone does this, and they're thinking about, well, I need to go back to work and I have to be able to drive, and it's, I feel embarrassed I don't have my license, and I really want to have this so my kids aren't asking me questions about why I'm not driving. And it's something I've already went down to the DMV and just started to check off like some of the things that need to happen next. So what I can do is just listening to all those little reasons and needs and steps toward change. And right about here, what I'm going to do is I'm going to reflect all those back, and then it helps me move into planning. So I might do something like this. I'm hearing you say that this has been really hard not having your license, and that you need to have it because you need to drive to work. You want to be a good role model for your kids, and that you've actually taken some steps to go down there and figure out what you need to do next. So, given all that, what will be your next step right now? And I personally like to have little goals, even little micro goals at the end of each session. I like to have something that someone's going to work on, something that they chose. It could be the tiniest thing, but what it does is it creates this idea, it really shapes a behavior that every time I come and talk to you, there's going to be something we're going to do, right? It's not just about venting, but about being able to be heard and listened to, but to have my behavior kind of shaped and managed and guided towards maybe even the smallest thing. So I'm trying to help someone move toward goals that are meaningful to them, but do it in a way that's really highly scaffolded. So we're doing the things that they know they can do. I was teaching a developmental psychology class this weekend, and we talk about, the idea, you probably remember this from way back, but like the idea of zones of proximal development, right? Like we want to, go right up to somebody where they're able to do the next thing and just help support them and just doing that next thing. And each time we kind of model and support, we're moving it just a little bit further down the line, and they're being able to get that much closer to an overall goal. I'm sorry. I got this twice in here. So you have the 4 processes again are just explained here. So some of you may have seen this, and it's like, okay, you've probably seen this a million times. Like, how do I get up and down those steps? And by the way, let me show you something else here. Sorry, I'm gonna go back for a second with these steps. So this is kind of a linear process, right? If you're thinking of engaging someone, helping them focus and being evocative, in our stages of change, we're probably at starting in pre-contemplation or contemplation. Up here, this is very, very contemplative, very contemplative. And then up here, we're probably getting into the preparation stage, like when people are starting to prepare right before they go into action. And I like to think at the top of the steps is a door. Sometimes in my slides, I have a little door up there. Like this is a door to action. You're walking up the stairs to go into action. And these are pretty, somewhat linear, right? We don't usually start with planning. We have to engage first. But as you know, we're messy. People are messy. So we go up and down the stairs. at times. And they also build on each other, kind of like a layer cake. So like when I'm engaging and I move into focusing, I'm still trying to engage somebody. And when we're being evocative and talking about concerns, we're still talking about a focused concern. And if someone's, starting to wander a little bit, I'll bring them back so we can keep talking. And at the very end, usually is where we start to make planning, but I'm still getting from them, like, what do they want to do for planning? So I'm still being evocative. So many of these things are still very much linked together. And so that this piece here is like, well, how do we go up those stairs, right? Like, what kinds of things am I doing to get up the stairs? And again, if you've been to almost any motivational interviewing training, you've probably heard of oars. Can't get anywhere without your oars. And the oars, which I'll explain for the rest of the training, these are your micro skills. And these are all evidence-based micro skills. We know from research, from like 70 years of research, actually. Dr. Miller and his colleague Terry Moyers just wrote a book on this. Psychotherapies at work, and all these skills that are in here. There's like a lot of research. Like, these things help people engage and move forward and have outcomes. And so you've learned all these. You learned these, and probably I learned them, like, I think, in a pure helping class when I was 19 years old. What is kind of beautiful about motivational interviewing is it takes these skills you already know, it helps you refine them, and it helps you apply them strategically. That's what's super cool. And again, you're going to use these skills no matter what you do, no matter what your job is, no matter what your theoretical orientation is. And I'm big into my slide backgrounds. And so, yes, the idea of like kind of moving forward, I actually call these skills, I actually use the mnemonic arose. I borrowed that from one of my colleagues, just because there's the OARS is O is for open-ended questions, A is for affirmation, R is for reflection, and S is for summary. And then there's this extra skill that's been added on in the last few years called providing information and advice with permission. And we often call it elicit, provide, elicit. So in the arose mnemonic, we actually have that added. So I'll be talking about that. So I put it here in case it's easier for you to see without the photograph in the back. So it's just a restatement of that. Some people like the photograph, some people do not. So there you go. Why are we're going up these stairs there, and we're using these like skills, which I'm going to go into in more detail in a minute. But I also just want to give you a little sense here about why are we using the skills, kind of where are we going, what's the point here? Yeah, we want to try to motivate towards change. Something's missing. And what's missing probably is a discussion here about change talk. So change talk is that language that the client states, that's their utterance, if you will, that helps indicate that they're moving at least cognitively toward change. And what we do in MI, this is again the very specific application of MI, is we are kind of noticing that change talk, and we are providing more attention. We're giving more attention to it. We're favoring it. We're focusing on it. We're using reflections that reflect back on it. We might summarize it. We might ask an open-ended question around it. So what it does is it helps kind of shape a path for the person we're working with to continue to go into talking about the reasons they want to change and their abilities to change and the fact they've been taking steps to change. So after a bit of talking about it, it makes a lot of sense for us to summarize all this change talk they've been talking about and say, well, so what do you think? What's going to be your next step? It gets harder to resist that question if I've just been talking for 20 minutes about all the reasons I want to change. And some people might still say, oh, I don't know. No, I don't think so. I don't think I do want to do anything. And then we can at that point ask for permission to help them out. Like, oh, you're not really sure what you'd want to do next. Have some thoughts about it. Would that be helpful for you? Would you want to hear that? And often, not always, but often people will be curious. The important thing there is we ask permission. More about that in a minute. So change talk is divided into what we call darn and cat. So darn is what we call preparatory change talk. It's a little mnemonic here for desire, ability, reason, and need. And the way I remember this, by the way, is that Disney movie, That Darn Cat. So sometimes I have clip art from That Darn Cat. Not a great movie, but great for this. You'll never forget this idea of change talk. And so what does that mean? It means when I'm talking about my desire, like I really want to quit smoking. I'd like to quit smoking. ability. I know I could quit smoking if I tried. Reason. It's often an if then, if I quit smoking, then I'd be able to exercise more. And need are very similar to reason, but it's a little more like I have to quit smoking. My kids are starting to notice and they're starting to imitate me, and I want to be a good role model for my kids. I have to stop. So why is this separate from the next category, which is commitment change talk? Why would we separate them out? What we've noticed in the research is that this preparatory change talk is definitely talking the talk, but when people are doing this kind of change talk, they're not yet walking the walk. And that's important because what happens is that providers get confused by this. And it's like, what's going on? Like they keep saying they want to quit smoking, or they keep giving me all these reasons and they don't do it. I don't think they really want to change. I mean, again, I remember being trained that way. Like, well, they're going to say stuff, but they don't really want to do it. And from the MI perspective, um, that's inaccurate. When people are talking change talk, it's not that they don't want to. It just means they probably aren't quite ready yet. And our job is to not dismiss that as like, well, they don't want to. Our job is wow, help me understand this. So this is really, been a big deal for you. You're noticing that your kids are really noticing you, and they imitate everything you do, and that scares you, right? We can do some very powerful reflections. There's things we can affirm. I'm getting this sense that for you, it's really important to be a good role model for your kids. And that quitting smoking is one way that you're planning on being a really good role model. And little affirmations. I mean, there's all these different these micro skills, what we can do to really, what I call build the stuff. Because what we found is that although the darn doesn't itself lead to change, what it does is it leads to CAT. And CAT is this mobilizing change talk. And what this is, it's a commitment, activation, or taking steps. So commitment is, I have a quit date for smoking. It's December 27th, right? Like I am going to, boom. Even though that's just talking the talk, what we found from the research is that when people are talking like that, they're more likely to walk the walk. That's why we do things like have quit dates for like smoking cessation, for instance. It's because when you start saying you're going to do it, you're more likely to do it. Activation is like a softer level of commitment. It's more like, I'll consider calling up that 1-800 stop smoking number, or I'll talk to my doctor. Maybe I'll talk to my doctor, just like maybe perhaps I'll check in with my doctor about getting a nicotine patch. So it's a softer level of commitment, but there's some willingness, and we want to be just like, okay, so here's something that you're thinking about doing. What might make that easier for you? We can kind of build on it. Taking steps is where someone might have a goal. I want to quit smoking. And then within that goal, they've done some things. Like they're not quite there, but it's something that's building momentum. I want to quit smoking. I've cut back from a pack a day to half a pack. So that's like an example of taking steps. And these are things like we all want to encourage, like, and be like, hey, it sounds like that's been a really important step for you. And that's a significant behavior change. Tell me more about it. So we try to get really curious with this. So where does this occur on those steps? It could occur at any time. Sometimes when people come in and their engagement, they're just getting started, they're already talking change talk. For a lot of people, though, it happens after we get them focused on their topic, and then, help me understand, become more evocative. That's where we really usually get into the change talk, is in the evocation stage. All right. A few more things I want to talk about, but we're doing fine in terms of time, kind of moving in there. And thank you so much for going into the chat box with me. So here's really something important to remember. And I sometimes tell people, like, circle the slide. If you don't have the slide, take a screenshot of it, or you'll get the slides. But I love the slide, and I love the clip art. I like the kind of going for the carrot. The thing to remember is that everyone is motivated towards something. They would not be talking to you if they weren't motivated towards something. And it might be, and often is, something that we never thought of, or maybe it's something that I myself would not be motivated toward, but they are, and that's exactly where we start. Maybe I'm someone who actually, needs to work on various aspects of managing my hypertension, and there's other things that are involved in that, like maybe more exercise or taking certain medications. But right now, the thing I'm working on, the thing I care about is quitting smoking, which is huge and important. So that's where I'm going to start. I'm going to start where the action is. Now, if hypertension is a part of this person's life, and I don't really want to take medications, I don't like the idea of taking them before, don't really want to take them, that's pre-action. So what we're going to do there is be like, okay, let's have a conversation about that. Let's have a conversation about the pre-action. And it's not about again, being in planning for pre-action is about working way down on those steps and being engaging and helping them focus on what might be their next consideration around medications, or maybe there isn't anything yet. We're just going to explore. All right. Another thing I'll say here, and there might be a couple slides after this, I skipped in order to get into the skills because I do want to make sure you have the skills today, and I want you to have all the slides. So a couple I move along. But this often happens when you're working with someone, and it's like it's hard to get a toehold on like what they're actually motivated by, right? So I'm saying everyone's motivated towards something. They are in there, and this happens a lot with young people, but it can happen with older people too, where okay, I'm motivated by staying out of trouble, but that's kind of as far as it goes. It's like they're not really providing a whole lot of other things, or it's like, yeah, I want to stay out of trouble, but then they keep coming back and they're still doing the same stuff. And again, the way I was trained is often would confront people, right? Like, hey, you want to stay out of trouble, but look at your, look what you're doing. You're out there like getting into trouble still. Are you actually sure you really want to quit, or you want to do something different? Because here you are. And what happens when we do that? There's a good one for the chat box. What happens when you come straight up to something else and just say, well, look at you, you're saying you want to do this. Like the confrontation. How does confrontation typically work out? If you think about it, yeah, there's pushback, exactly. Resistance, exactly. That's where shutting down, where we often get people being called resistant. Yeah, people withdrawn, resistance, defensiveness, absolutely. And avoidance. And sometimes the avoidance is like, I'm not even going to come. Walls created. Y'all have a lot of good ways of stating all of this process. And again, some of you may have a similar situation. This is the way I was trained in substance abuse counseling. Go in there, give somebody a haircut. Now, the thing is, the person knows, they know, right? I mean, they kind of know on some level, or leave the program exactly. The thing we want to think about is like, how do I confront someone in a way that motivates them as opposed to pushing them away? So here's an MI where we do the fantastic thing, what we call develop discrepancy. So instead of like butting heads, like this ram picture I got going on here, we do what I call, I should get an itchy sweater. I should get a sweater, like a big woolly sweater picture for this slide. I call creating the itchy sweater effect, which is I look at like what they're doing, their behavior, and I kind of put it together with what they say they care about. Right. So what it does is I'm just coming at it from a curiosity point of view, is it does a kind of internal confrontation. And it's not about me saying as an external like authority figure, you better. It's more about help me understand. Because you're saying that you really, you want to be a good role model for your kids, and that smoking's really getting in the way. And you're just telling me right now that you'd still been smoking, a number of cigarettes a day and weren't really thinking much about changing behaviors this week. Can you help me understand how that was working out for you? And for some people, that statement there might be too much of a confrontation. But I try to use like their language, right? The things they're talking about. I'm noticing that you're saying you're doing X, Y, Z. And I noticed last week you were saying you really want X, Y, Z. How are those two things kind of working out? I think Dr. Phil says something like, "How's that working out for you?" And a lot of people say that. And it's kind of true. It's like it's really kind of where we're going. Like these are your things going on. How's that working out? There's an old 12-step saying that I remember, and I think I'm paraphrasing it correctly. And it was something to the kind of position of the bad things about AA meetings is that they really mess up your drinking. And so the idea of that is like you go to a meeting, you're in community, you hear people talk about being in recovery and what they're doing around that. And then it gets really hard to go out and drink afterwards because that stuff is still kind of rolling around in your head. And that's basically developing discrepancy. No one's going in there and saying like, you should do this or you should do that, but kind of witnessing kind of what I know is going on, what I'm doing with like, these are the outcomes. Do I really want that? So that type of developing discrepancy is what I call creating the itchy sweater, because people leave us right? And so if I've already kind of put them in a place of thinking about, yeah, I want this, but I'm doing this, they keep thinking about it like throughout the week, and it can actually have an impact. So, got a little bit about some of that, little more slides there about different ways of developing discrepancy. So, one of the things I like to say about these micro skills, and this is where I'll finish today, is really just talking about the micro skills and giving you examples of what they are, is they all help really promote empathy. So, empathy is really about this true listening. It's not about telling people, like, let me tell you my story or my own lived experience. I mean, although people use, and certainly peer providers use lived experience, and that's great. That can actually be very helpful for people to get this sense of safety and to get information that feels appropriate. And that in of itself is not empathy. It's like it's still my story that I'm telling. And that, to do it in a real empathic way, we ask permission, and we try to see like how my story's been helpful for you, etc. Just because I've had the same problem doesn't mean I'm going to be empathic. And again, many of us in a substance use treatment programs have seen that exact dynamic occur, where someone might not be that empathic, even though they had the same problem. In fact, sometimes because we've had the same problem, we might not be terribly empathic because "Well, I did it. Like, why can't you?" So empathy is really about being able to take in what someone's saying, to decode it, then to be able to come up with a way of reflecting it back. So it's like there's this recognition, like, yes, you heard me. It's about being able to be mirrored. It's about someone noticing also things that I'm doing right. There's aspects even of our open-ended questions that allow people to really express kind of what's going on for them. So again, I like to use the rose mnemonic, just the with affirmations, reflections, open-ended questions, summaries, and elicit, provide, elicit. So it's the same as the ors. It's just I now have a letter for the elicit, provide, elicit, which is how we give information and advice, which is a very, very helpful skill for probably every single person on this call. At some point, you're probably going to be working with expertise, with your expertise, and you're going to be wanting to help share that with people. And even though you have expertise, it doesn't mean that the folks we work with want it. So it's like, how do we position people to be able to take it in? So in half an hour, I'm going to go through some of these, and hopefully you'll be able to kind of get a good sense of this. And I might have you do some things in the chat box. So the first one is reflection, and I always come up with little metaphors for everything I'm doing. So reflection is about really truly mirroring people back. Reflections are statements rather than questions about what's going on. It's about, I am decoding and making sense of what you're saying and understanding your meaning. And in this mirroring back the statement that comes back in a sentence, what I am doing is I'm showing like a deeper understanding of your experience. But I'm not telling you, or I'm not asking you like what it is that's going on. I'm doing that work. I am doing the work of trying to figure out and actively listen. And I'm listening because the activity around it is me being able to do this reflection. And it's really powerful. They often yield, reflections do, more understanding than a question, because folks are more likely to respond to reflections. It feels more natural. It feels like this sense of being heard. Whereas questions sometimes, especially if we ask too many questions, it can just feel overwhelming and interrogative. And it's like, it's just too much. So what we want to do is we want to be thinking about, what does this person mean? Like, what's underneath like what they said? And we want to reflect back, oh, I'm hearing that you're saying this, or it sounds like such and such is going on. And we cut the question words at the end, and we do not inflect up, right? We make it like a sentence and inflect down. So we see this a lot when people are trying out reflections, like things like, oh, it just seems like you are really unsettled because you had a really bad fight with your mom, as opposed to, seems like you're really unsettled because you had a really bad fight with your mom. One is a sentence and one is more like a question. And that happens a lot when people are feeling unsure of themselves. And I think there's also a reticence. Oh, I don't want to tell people what they're feeling. And here's the thing, if we are off with the reflection, you'll know. And the reason you'll know is someone might tell you straight up, like, no, that actually isn't what's going on for me at all. It's like, okay, so that's not what's happening. And then, tell me what is. Like we can actually ask a question then if we're just really unclear. But often people will like, no, it's not really that. It's more like this. And then we can reflect on the clarification. We're doing this dance, and reflections help create a dance if they're accurate. If a reflection is not accurate, you will know often if someone doesn't tell you, because you'll start to feel like you're wrestling. You'll feel off, right? And you'll be out of sync, and you get that sense of like, no, not really that. Or they just kind of get quiet. And that's like, okay, there's something here I'm missing. So here's the good thing about reflections is that they can be simple and they can be more complex. So simple reflections are basically where I am not really adding any meaning. I'm just kind of maybe simply paraphrasing, or maybe I'm just using a piece of what someone said. And very simple. It's not no depth to it really. It's just I'm purely being a mirror. Yeah, I'm really mad today because I got into a fight with my mom. I might just reflect back, oh, fight with your mom. And that's not bad. It often functions, especially early on in a session, like an encourager. It's like a way of just, okay, heard that, kind of encourage. Is there a problem though if my reflections are too simple for too long? What happens if I only use simple reflections? As you heard really hot in the chat box, you can get that in there. Move on a little bit while I'm waiting for that answer. So that's piece of simple. And then complex, yeah, feels canned, kind of feels like you're not paying attention. You start to feel interested. Yeah, just interested, interesting. Feels robotic. Things start getting really circular. That's where I get like clinicians sometimes saying like, it feels like I'm a parrot. And yeah, following emotions. I think this is important. What Anna says here, it doesn't feel genuine. And interesting is the conversation I had with a developer yesterday. It's one of the things we sometimes have a hard time measuring in sessions is like genuineness. We know it's really important, but we have a hard time sometimes fully measuring it. So anything that we know isn't genuine, like we know that's important to avoid. And so even though simple reflections can be fantastic, when we're just trying to like looking at kind of Marina's idea here, like someone is just getting started, just getting engaged. We want to just see what they want, that kind of thing. That's great. But more often than not, we want to go to the deeper reflections, right? And that's more complex reflections. So that includes like more advanced paraphrasing where we're using like different words and maybe words that they're not using. Something we call continuing the paragraph, which might be what the person would keep saying if they kept talking. So in this conversation, yeah, I had a really bad night last night, got into a really bad fight with my mom. And that leaves you feeling just not sure about whether or not you even want to talk to her today, right? So maybe I just kind of continued that paragraph. And what I added in my little paragraph piece there was maybe other information I had, in addition to what that person just said. But it's like moving them along in the conversation. You usually start with a conjunction, oh, and so that, or oh, you should, or not oh, you should, but or so you could, or you're kind of putting the next thing that somebody might be saying in the paragraph. Reflection of feeling is the listener paraphrases the emotional dimension of what was said. Now, last night I had a really bad fight with my mom, and I might say something, and you're feeling really sad this morning because you're not talking. You're feeling really frustrated because you just can't get through to her. Reflecting at the level of feelings powerful. Many times people talk to us and they're using all kinds of feeling, but they're not actually stating it. So when we reflect back, feeling it often definitely goes deeper. Definitely goes deeper. A metaphor it's a powerful reflection via some other kind of image or story or idea. I was just thinking today before class. This is not something clinically related, but some conversations I know I've been having with friends about booster shots, and again, booster COVID shots, and many of us I got one. But just the ambivalent feeling we've had about booster shots. No, we're getting shots, and maybe other people in the world aren't. And someone was telling me about the World Health Organization clearly being upset about a lot of people not getting booster shots. Totally makes sense. There's a whole big part of the world not getting booster shots. And I'm telling you this because they use such a great metaphor, a really powerful metaphor. It's like, it's like we're all out there in the sea kind of floating around. And, some of us have life jackets and some of us have no life jackets. And in some ways, people are seeing booster shots. It's coming by saying like, oh, your life jacket's kind of tattered. Here's another one. When we have other people who don't have life jackets. And that metaphor is like really powerful, right? I mean, that's like makes me really aware of like of just how much people are struggling, and it gets to you in a certain way than just saying, well, it's really not fair. We have all this resource and other people don't. Because sometimes that can be easy enough just to kind of push aside, but that image, right, of being in the water and the life jackets and having someone hand you a new life jacket, it's a very powerful, really brings it deep. Got me to make a big donation to the COVID vaccine um, efforts. So just as an idea there, right? Just how much like those kinds of metaphors can be really compelling, right? Just as an example. And I know people have different feelings about that, but I just thought I'd put that out there. Double-sided is when we reflect both sides of a conflict. On the one hand, you've got this going on the other hand, you're feeling this way. This is great for ambivalence. So I might say something, on the one hand, you really feel like, it was your turn to stand up to your mom. And on the other hand, you feel really bad and hurt that such hard words were exchanged between the two of you. And you notice I did a couple things there. I did an and in the middle instead of a but, because if I start saying a but, then what it does is it excludes like the other side of the ambivalence. And what can happen is someone can start to defend the other side of their ambivalence. So we have to kind of bring them both together. We call it the both and. You're both this way and you're this way. And to help people kind of sit with that conflict. And we also put the change talk, the very last thing. So in this case, the change talk was about, not wanting to get into fights with mom. And so that's the last thing that someone's hearing. That helps kind of move towards change. And then there's amplified, which is like strategically overshooting the content or feeling. It gets people to think about other aspects of the status quo. Amplified reflection is not something you'd go to all the time because it could be a bit off-putting. But if you have someone who's really digging in their heels, they're really in the status quo. That's the opposite of change talk. And it's like, I'm not going to do this. There's no way you can make me do it. I'd like to see you try. It gets to be very difficult, right, to have a conversation about change. So what we do is we do a bit of amplification because it makes someone kind of back off. So let me give you an example of this. Not uncommon for me to have, like, say, an adolescent who's really into smoking cannabis, right, as an example. And it's like, I know they're telling me I should quit, but you're not going to make me. It's my medication. I love it. It's helps me be more creative, whatever, right? They're going on. And I might say something like, got it. So weed is like your best friend. And there's no way I'm going to be able to ever get you to do anything you don't want to do as far as quitting weed. And what I do is I've just kind of gotten out ahead of them. And what happens is sometimes I'll back off. Sometimes I'll even say, well, it's not my best friend. We have other things I care about. Okay, I can start looking at that. And sometimes I find it often just gets people to stop challenging just because it's like, I'm not going to fight you. Here's a metaphor. I'm dropping the rope. I'm not going to get into a conflict with you around this. I get it. You just love this a lot. So sometimes that's how the amplified work. Again, not something you're going to use with everyone all the time. Just when someone is really doing the opposite of change. So typically this would be a time when we would do a little bit of practice with that. And one of the things we could do, I'm just trying to think about time. If I may have to just move along for a time here, but one of the things I have people do, if you're thinking of wanting to practice this more, is just even take like a client statement and think about like if it was just like at the top of like, it's like a piece of iceberg that was sticking out of the ocean. This is a great little exercise that sometimes do. And think about what could be under the iceberg, the stuff that's not being said. And from there, that could be a really great place of being able to make a reflection. You could even just like write down all the other potential meanings that are underneath the iceberg. And from there, that's where you can start to do a reflection. Let me just move along here into a couple of things I can actually give you a little practice time too, with open-ended questions. So my metaphor for open-ended questions is the open door, right? So these questions do not close the door. They do not just give simple answers. They actually demand that people say more than a couple of words. So closed questions are like, did you attend your appointment this week? Yes or no? What's your phone number? I'm just getting specific information. Sometimes we give like multiple choice, and sometimes that can be helpful. Like, well, do you plan to quit, cut down, or keep drinking? Like if we're just trying to get a direction that someone wants to go. And they're all useful at times, but they limit what someone can say to us. So in motivational interviewing, if we're trying to be evocative, we actually want to do open-ended questions. They open the door, they encourage someone to talk. They do not invite a short answer. They give a lot of latitude. Here are some examples. So you can use the chat box. We'll see how well this works. Or sometimes I just have people like go off mute and just start yelling out. Actually, sometimes that's faster that way. But it's kind of a fun little game, which is open or closed. What would you like from treatment? Open or closed? Open, you're right. Open. Was your family religious? That's closed. You're right. You're right. The things like is or was, like some people might get if I wanted to make that open. How would I say that? If I want to know about somebody's family's religious background and make it open, how would I say that? Tell me about your family's religious background. Exactly. Exactly. What is your religious preference? Tell me about your family's faith. Like exactly. Tell me about your psychiatric medications. What are the good things and the not so good things about them? Open or closed? Those are open, right? We often do that in MI. The good things and not so good things, as opposed to good or bad. Because sometimes if you say bad, that's just enough judgment where if someone's ambivalent, they'll start to defend it. There's nothing bad about this at all, especially if it's around the substance they're using. If you were to quit, how would you do it? Yeah, that's open as well. And so the what would you like, the how would you, those are often open. The well, like this one, when is your court date? That's closed. Yeah, sometimes the when can also the when or where can be closed. Not always, but often. So some guidelines with questions. We want to ask fewer questions and try not to ask more than 3 in a row. This is actually a really important slide too. We want to ask more open than closed questions. And we like to do this thing called a sandwich. We like to sandwich in like a couple of reflections between every question. So it's not just like question after question after question. There's a question, someone gives an answer. Oh, let me reflect on that a little bit. And then if I need to ask another question, I will. But we often do a lot of reflections before we ever get to any questions in MI. If someone's a really competent provider, they can actually get to a lot of what they need before they end up asking lots and lots of questions. Like reflections can be our pathway to really provide getting a lot of information, a lot of change talk. Okay, thank you for that. So just a little exercise here. So affirmation, this is the A in a rose. And what affirmation is like going up to somebody and have a magnifying glass and finding their places of strength. Because as much as we are charting and documenting problems, because that's what we need to do to prove like medical necessity, and like we need to document to like people's struggles and the places where they're not functioning. If we actually want to help somebody improve their life, we leverage their strengths. We find the places where people are successful, and we come build on that. What is an affirmation? It's a positive reframe. It emphasizes a strength. It notices and appreciates a positive action. Could be generous. It expresses positive regard and caring, and it often functions to improve our relationship. So some of them can be pretty simple, like, "Hey, thanks for coming in today. Or like this, like, I appreciate you. I like the way you said that, and hey, I hope this weekend goes well for you." Like it just kind of positive interactions. Some of them too can really be I think a bit more complex. We call them more complex. Like if we really are looking at this top one here, commenting positively on an attribute, you're a strong person, you're a real survivor, as an example. So one of the things I like to do is so I'd like to give us a chance often to think about the affirmations we could start to give folks that we work with. So how do we do that? Well, sometimes we have to be careful, right? Because I've had a lot of providers say this. Sometimes their own clients start to feel as if they're being judged, or it feels patronizing, sometimes an affirmation. So here's a solution to that. And one is to really focus on specific behaviors and be very descriptive. And if it's an area where they're struggling, it might not be something terribly clear to affirm at that moment. For instance, if I'm someone who's like using a lot of substances, that might not be the area where there's a lot to affirm, but maybe I'm still being, very responsive to my kids. That would be maybe an area to affirm. And sometimes we just think of, what are some interesting qualities that people are coming in with that I can affirm? And I'm trying to help this person develop a positive worldview. So here's kind of a fun thing we can do here just for a second. And I think this exercise is helpful anyway. I think it helps reduce burnout sometimes amongst staff. Is in your chat box, just type in some positive traits of the people you work with. Different things that they show up with, skills. Okay, There you go. Thank you. Energetic, generous, open-minded, sense of humor. I mean, funny, organized, thoughtful, empathic, intuitive. I can't even keep up. You're so fast, which is fantastic. Resilient, positive attitude. They show up exactly. Creative, resourceful, genuine, lovely. Keep them coming. I actually think like this exercise right here is really important to help providers with their own potential burnout sometimes, right? Because we're often so focused on trying to treat some really difficult issues that it's hard to get ahead of that and to be in a place of noticing all the places of strength. So when I'm working with an affirmation, I could do a couple things. I could be asking an open-ended question to say, tell me about a time when you've really worked hard to overcome a challenge, and maybe that would help generate some discussion about someone's resiliency. Or I can also use an affirming statement. So I'm just randomly just looking into the chat box right now. And if I had as resilient as my thing I'm trying to affirm, my trait, I might say something, and I often do it this way, so it's descriptive. I often say something in a way where I start with I observe, I see, I hear, I notice. So that way it makes it more of a description, because I want to avoid saying, oh, that's so good that you are able to solve your problems when things get tough, right? Because as soon as I make it like an evaluation, what if next week I don't solve my problems? Like it becomes like, is Kristen going to have a problem with me? Or is somebody going to have a problem? Or that just sounds patronizing. But if I say something, hey, I notice that when things are really tough for you and your back's up against the wall, you find ways to really be creative and find solutions to some very difficult situations. Like that was just kind of a description, and maybe I could get even more descriptive if I had a very specific example with someone of how they've performed well. Again, just looking in the chat box, curious, I might say something to someone. I see that you really like to get in and explore and learn a lot about the world and about different things you could do to just enrich yourself, and different things you could do just to solve some of your own problems, right? So that's kind of affirming their curiousness. I see willing in the chat box. I could always say something like, I'm aware that you are really open to a lot of suggestions that people give you, and you've been able to test out a lot of different options, right? So these are all ways that we can affirm people that are real, that are relevant to them, that notices them, and it notices their strengths in a way that I think is non-judgmental and also not condescending. Two more things and about 6 more minutes. So noticing the background here, it's a beautiful bouquet. And that's the metaphor for summaries. If we have someone just giving us individual pieces of their lives or individual pieces of change talk, for instance, like that's great to reflect on and to bring that back to them. I'm seeing here that you really care about your kids, and that's an important aspect of your wanting to change. What I want to do with summaries, though, is I'm actually collecting. So when I collect like all the different change talk, number of things that people have said, just like an individual flower is very beautiful potentially, a bouquet is more impactful. We tend to sell flowers and bouquets because it's so beautiful when it's brought together. And similarly, for this metaphor, when we can bring together a bouquet of change talk, it becomes much more powerful. It's really compelling. Then it's not just like kind of my random thoughts, but it's about the needs I have, the abilities I have, the wants, the ways I've taken steps. So we try to be as brief and selective as we can, because as you can imagine, and as you've experienced, summaries can be very long, right? We can go into a whole bunch of detail and then it's like you lost somebody. So if I can think of a summary that's no more than a couple of sentences, that's great. They helped collect information. They help link maybe to something that was said before. They help us transition to something new. And what we can do is we can include some part of the ambivalence or the status quo, but we really want most of the change of the summary to be about change talk. If we're hearing change talk, sometimes very early when we're engaging and just helping somebody collect their dominant themes, there may be no change talk. So it might be something like this. Okay, so I'm hearing so far that you've always really liked to smoke. And I'm also hearing that you want to be a good role model. So that's kind of used this one before. You want to be a good role model. You're tired of spending all this money, and you don't like smelling and being kind of looked at work when you go out for a cigarette. So you notice in that summary, this kind of one sentence, I put the status quo, I really like to smoke, so they know that they're acknowledged. But then I put all these little pieces of change talk at the end, and it's a number of pieces of change talk. So it becomes really compelling about, I really should do something about this. Are we all doing okay? So with my last 4 minutes here, I'm going to give you this last skill, which is to me one of my favorite skills, really important for information exchange, which all of you are doing, and advice and case management, care management. This is very helpful. This is called elicit, provide, elicit. I often call this like the handshake, although this is my pandemic approved handshake image. And what this is like the E in a rose. So we call it elicit, provide, elicit, and we have to assume that even though we have expertise, that people don't necessarily want it or understand it, or they're not necessarily ready for it. Like I might really want it, but not right now, right? How many times have you received really good advice, but you just can't take it? Like it's just badly timed or just in bad, just not doing it. And sometimes also the way it's put on, it's just like, it's especially if someone's like really intense about it. Oh, you should do this. No, this is what you should try. There's something about us. There's some relationship to this, we believe, to social dominance of like really it's part of survival, not being told what to do sometimes. But what we're trying to do then is like, okay, I can see where someone here is really struggling. I have information. I can actually help them. How do I just be conversational and curious? And that's where the ask, offer, ask, or the elicit, provide, elicit comes into play. So it's the E in the rose because it's elicit, provide, elicit in the literature. Although many of us like to call it ask, offer, ask because it just makes it normal. So the process goes like this. The first thing is we elicit permission or just like what somebody needs. So it might be something like, I'm hearing you talking about you're really struggling with housing options right now. What do you already know about what could be your next step? So we might do that kind of ask, like just finding out from them what they already know, and sometimes find out there's a whole lot that they already know, and there's not even much I need to provide. So this one could be, you know what, I've been hearing you talking about housing and you're really struggling. I have some thoughts about that might be helpful. Would you like to hear it? And you give a choice, and some people can say no. Most people will say yes. They're at least curious. And it's not even, I guess I should back up here. It's just what's so important is that we've asked. That's what's important. It's just I showed a boundary. My metaphor here is this is kind of like a knock at the door, a very friendly knock at the door. Is it okay for me to provide this to you? And that boundary can really open people up to being willing. Then we offer. We want to be brief. We want to prioritize what we say. We don't have much time. The metaphor someone gave me was, I want to do eyedropper here and not a water hose, and not a fire hose, right? Too much information, people just get blasted back and they stop listening. But if I just give a couple little pieces, I want to be careful to not prescribe somebody's response, which is to say, you're going to love this. Right. I have to be careful not to say that. And I also have to support autonomy. Like, this is up to you. I mean, this might not be helpful at all, but this is up to you. Right. So then what we do after that little eyedropper of information is we do the second ask, which is basically their interpretation, their feedback. Here's kind of where the handshake comes in. What do you think about this? Does this seem helpful? Is there something I missed? And then, if someone's like engaging in this like information exchange, we don't have to keep doing this over and over again. Like, as we're having a conversation, we can just have a more natural conversation. But what this does is it gets us in the door. So I've actually gone through all the skills. I'm very proud of myself. We do have traps, which I'll let you look over when you get the slides. And so the last thing I'll do, since it's 10:30, is thinking of what we're doing, the MI Hill here, is we're listening in the early stages to preparatory change talk towards action. On the bottom of the hill, it's kind of closely corresponding what's going on. We often will hear someone preparing to change, sometimes really early, often in the contemplation stage, maybe even pre-contemplation. Once we start to get into preparing and moving towards action, that's where we start to hear that mobilizing change talk. I've left here some literature for you. We've actually gone through almost every single slide in that time. I'm very pleased. And these are some of my favorite books. And I also have on here some websites. And the websites I have curated to be websites where you can find a lot of free material of like free resources and publications. I'm going to encourage you to check out something. If you are not wanting to buy the MI book yet, you're thinking about that. That's the Substance Abuse and Mental Health Services Administration. And I have it right here in the slide. Just go in there, or you can go to publications, or you can just put into your search engine just SAMHSA and tip 35. And tip 35 tip is a treatment improvement protocol, and number 35 is all motivational interviewing. So it's all motivational interviewing and substance abuse, but it's basically just substance abuse as a topic. But it's all the MI material, and it's in tons of detail, and it's free. It's really nice, and it was all updated in 2019. So the book, the motivational interviewing book, is going to be updated in 2 years, and the current book out there, it's about 8 years old now. So this is actually a lot fresher information. So something free. Hope you can enjoy that and find it useful. And
Thank you so much,
I will.
Kristen. Turn it over to me.
Great.
All right. Thank you so much. And everyone, thank you so much for taking the time to be here today. We appreciate everyone who's joined us. A follow-up email will be sent this afternoon to all those that participated, and it will include the PowerPoint presentation, a link to today's Zoom recording, and some information about our next training, which will be with Kristen Dempsey on December 14th. We hope you can join us. If you have any follow-up questions, please don't hesitate to reach out or reply to the email. I'm happy to help in whatever way I can. To be able to get continuing education credit, you must complete the evaluation survey. I've put the link into the chat box a couple of different times. You'll see on your screen a QR code. You can access it via your iPhone by using the camera app, or if you've downloaded the QR reader on your Android phone, you can also access it there. A link will also be sent to the follow-up email. So thank you again, Kristen. A fabulous training. Talk about a fire hose of information. We all appreciate it so much.
I'm my own fire hose. Yeah.
We are looking forward to our next training on December 14th. Thank you so much for being here, and we will see you next time.
Thanks,
Bye,
everybody.
everyone. Thank you. And thank you to our sign language interpreters, Cassandra and Liz. Thank you. Thank you so much.